Unusual fatigue and subtle body changes. Could they be signs of diabetes? Fatigue, skin changes, and other seemingly minor symptoms may not just be part of your busy life. They could be subtle but important signals of something much larger. Diabetes, especially in women, often begins with small whispers that are easy to overlook. But understanding these whispers can be life-changing. Let's dive deeper into the early warning signs of diabetes that every woman should be aware of, starting with one of the most under-discussed connections. 1. Polycystic ovary syndrome, PCOS. A double-edged sword. Polycystic ovary syndrome, PCOS, is a hormonal condition that impacts millions of women, often causing irregular periods, excess facial or body hair, weight gain, and acne. What you might not know is its strong connection to diabetes. At the heart of PCOS is insulin resistance, where your cells struggle to respond to insulin. To compensate, your pancreas pumps out more insulin. But here's the problem. Excess insulin not only fuels the hormonal imbalance driving PCOS symptoms, but also sets the stage for type 2 diabetes. Think of insulin as a key that helps your cells absorb glucose from your bloodstream. In insulin resistance, the key doesn't work well, so your body produces more and more of it. This overload doesn't just stop at insulin. It forces your ovaries to release higher levels of male hormones like testosterone. For women, this creates a double burden, managing the symptoms of PCOS while also being at a higher risk for diabetes. If you've been diagnosed with PCOS, it's crucial to monitor your blood sugar regularly and address insulin resistance to reduce your risk. 2. Yeast infections. Sugar-fueled overgrowth. Yeast infections, while common, can carry a deeper warning if they become frequent or unusually stubborn. Why? Yeast thrives on sugar, and elevated blood sugar levels, typical in diabetes, create the perfect breeding ground for this overgrowth. When blood sugar is high, some of it spills into your urine and tissues, including the vaginal area. This excess sugar feeds the yeast, allowing it to grow unchecked. Women with undiagnosed diabetes may notice persistent infections that don't respond well to typical treatments. While not every yeast infection is a sign of diabetes, recurring ones, especially alongside other symptoms like fatigue or frequent urination, shouldn't be ignored. Your body may be signaling that something deeper is happening. 3. Urinary tract infections, UTIs. A bacterial breeding ground. UTIs are another common issue for women, but frequent or unusually severe infections could point to diabetes. Elevated blood sugar levels not only provide food for yeast, but also create an environment that encourages bacterial growth in the urinary tract. When sugar seeps into your urine, it becomes a rich source of nutrients for bacteria, increasing your vulnerability to infections. Women with undiagnosed or poorly managed diabetes often experience recurrent UTIs, which may require longer treatment courses or keep returning despite antibiotics. A pattern of frequent UTIs might not seem alarming at first, but it's worth exploring whether high blood sugar is playing a role. 4. Skin changes. A visual clue from your body. Your skin can sometimes provide the first visual sign of underlying diabetes. One specific condition to watch for is acanthosis nigricans, which appears as dark, velvety patches of skin in areas like your neck, armpits, or groin. This condition is closely linked to insulin resistance. When your body produces too much insulin, it can overstimulate skin cells, causing them to grow faster and produce more pigment. The result? Noticeable patches that can feel thick or slightly raised. While these skin changes alone don't confirm diabetes, they're often an early marker of insulin problems. If you notice them, it's worth investigating further. 5. Reduced sensation. Tingling, numbness, and neuropathy. One of the more alarming signs of diabetes is neuropathy, or nerve damage, which often starts with reduced sensation in your hands and feet. High blood sugar damages the tiny blood vessels that supply your nerves with oxygen and nutrients. Over time, this damage impairs the nerve's ability to send signals to your brain, leading to sensations like tingling, numbness, or even sharp pain. For women, this reduced sensation can be particularly concerning because it increases the risk of unnoticed injuries, infections, or ulcers, especially in the feet. Left untreated, these issues can escalate into serious complications. 6. Fatigue. A telling energy drain. We all feel tired sometimes, But diabetes-related fatigue goes beyond normal exhaustion. Here's why. Your body relies on glucose for energy. In diabetes, high blood sugar disrupts the delivery of glucose to your cells, leaving them starved for fuel despite plenty of sugar circulating in your blood. This creates a paradox. Your body is swimming in energy, glucose, but it can't access it efficiently. For women, this means persistent exhaustion that doesn't improve with rest or sleep. If you feel constantly drained and can't pin it down to lack of sleep or stress, it might be time to consider a deeper cause. 7. Blurred vision. A window into blood sugar levels. Blurred vision might seem like an isolated issue, but it's a classic sign of fluctuating blood sugar. Here's what happens. Excess sugar in your blood pulls fluid from the tissues in your eyes, including the lenses. This distorts their shape and temporarily affects your ability to focus. While this symptom often improves once blood sugar levels stabilize, persistent or recurring blurred vision, especially paired with other symptoms, can indicate a deeper issue. 8. Frequent urination, a never-ending cycle. Frequent urination, particularly those late-night trips to the bathroom, is one of the most common early signs of diabetes. When your blood sugar levels are high, your kidneys work overtime to filter the excess glucose. But when they can't keep up, the extra sugar is excreted in your urine, pulling water along with it. This not only leads to increased urination, but also triggers excessive thirst, creating a vicious cycle. For women, it can feel like a never-ending loop of drinking fluids and rushing to the restroom. Recognizing these symptoms early can be life-changing. If any of these signs feel familiar, don't wait. Consult with a healthcare provider to evaluate your blood sugar levels and take control of your health. Before you go, there's one more thing you need to know. Watch our next video. 7 early morning diabetes warning signs you should never ignore. Save your life today. To learn how diabetes may already be impacting your mornings, click here now to keep learning and take the next step toward protecting your health.